We continue to try to get your questions answered and bring you the most current information. This afternoon, Dr. Alex Garza, Chief Medical Officer for SSM Health and the head of the St. Louis Pandemic Task Force, is joining us live here on News 4 at 4. Dr. Garza, I know you're busy these days, but thank you for taking time to get some important information to our viewers.
Yeah, anytime.
What is the single biggest challenge facing local hospitals and their employees right now?
It's sort of a mix of things. So it's definitely the increase in the patient volume for COVID. There's certainly a strain on personal protective equipment going on. And I would say it's also the anxiety that is, that increases every day as we see more patients. And so that takes a toll on our workforce. And so there's really no one thing. I would say it's a combination of things that are really putting a stress on the healthcare system.
Let me follow up on that and the anxiety on the healthcare workers. They're on the front lines doing incredible work every single day. You're in contact with many
Absolutely.
on a daily basis, really on an hourly basis. How are they holding up in general terms?
They're doing okay. I wouldn't say that that they aren't without some level of stress. They definitely are. You have to imagine that these are folks that are literally, exposing themselves. They're wearing their personal protective equipment, but they go home to their families as well. And so they worry about their families. They worry about their personal exposure. And in addition to healthcare just being a very stressful job to begin with. And so by and large, they're doing well. But there's a lot of stress out there.
Dr. Garza, you said that we will hit peak sometime in the next couple of weeks. We're now on the steep part of the curve, and that you said there could be 80,000 people infected by the end of April. That's a big number. Is that number for our entire region?
That's for our entire region, and I want to clarify that number a little bit. So, the 80,000 includes people that are asymptomatic, that may have a mild illness, as well as those that are hospitalized and need ICU care. And so that's really all comers. That isn't just people that are going to show up at hospitals. And we know that there's a significant proportion of patients that don't show any signs at all, somewhere between 30 and 50%. And so those numbers are really based off modeling, off of our known positive patients. And so it's not out of reach that we'll hit that number.
There is concern that in worst case scenario that PPE will run short, ICU beds will be in short supply, ventilators as well. You said today that we in the community control that. If we don't help control it, what does the real world scenario look like?
Well, hopefully we'll never get to that. And that's what I'd really like to focus on, is preventing us from ever getting to that scenario where we would run out. So we have contingency plans in place on how we can increase we call it our space, our staff, and our stuff. So how can we increase our space? By utilizing ORs for ICUs and other places that we can use. How can we increase our staffing ratios so that we can take care of more patients? And then how can we utilize our equipment more efficiently? And so that's, doing things like converting anesthesia machines to ventilators and things like that. And so we take a look at the extreme case, and then we backwards plan, and we come up with different planning scenarios so that we can meet the demand.
Dr. Garza, there's a national debate going on about hydroxychloroquine, its effectiveness in fighting COVID-19 versus its potential dangers. What would you advise our viewers about the use of that drug in treating COVID-19?
Well, I would follow the advice of Tony Fauci, to be honest, and he's been pretty clear. There are some anecdotal reports that it does help with COVID-19, but when you look at things from a very scientific perspective, there hasn't been the randomized controlled trial that you would absolutely need to say whether it is effective or not. And so the jury's still out on that.
Dr. Garza, I live in St. Louis County. I'm seeing very few cars on the road when I'm out, very few people at grocery stores, people being respectful of maintaining social distance. It strikes me that a majority of people in our area are taking this seriously. What are your observations? And at this point, what gives you optimism?
I'm seeing the same things that you're saying when I'm out going to work and things, and so I see fewer cars on the road, fewer people at the stores, which is good. So people are practicing social distancing. What gives me optimism is exactly what you're saying, is we're noticing that the community is taking this as something that needs to be dealt with. As I've tried to, implore people to do, the way that we avoid from overwhelming the healthcare system to avoiding deaths is really dependent upon the community. And those are the simple things like although it sounds simple, it's tough to do, and I recognize that. But it's social distancing, washing your hands, cleaning surfaces, all of those very simple things that can decrease spread.
Dr. Garza, thank you very much for taking time for our viewers this afternoon. We really appreciate it.
Absolutely. Thank you.